The Lagos State University Teaching Hospital, also known as LASUTH, is a state-owned teaching hospital in Lagos, Nigeria. It is strategically located in Ikeja, the state capital. In the midst of the coronavirus pandemic, we are curious to know the role of LASUTH, and that is why we are here. This tertiary healthcare facility is one of the fastest growing research centers and teaching hospitals in sub-Saharan Africa. Our crew met the Chief Medical Director, Professor Adetokunbo Fabanwo. He enumerated the critical contributions of LASUTH towards the success story of Lagos State in containing the coronavirus. Professor Fabanwo said LASUTH triggered its COVID-19 emergency response strategy even before the state recorded its index case on the 27th of February.
Even before the index case arrived in Nigeria, our hospital had been preparing for it, and we had ensured that we got enough protective kits for our doctors. We got sanitizers, washing liquids. We ensured that water was running everywhere. Okay, then the index case came, and after that we increased our level of screening. So every patient that came was thoroughly screened. We took a history, including travel history, which we were not necessarily doing before. But then we started asking about travel history. We started taking temperatures of all patients that came, and anybody that had suspicious symptoms, COVID-like symptoms like cough, chest pain, respiratory distress, we treated them as COVID suspects.
Professor Fabanwo also used the opportunity to shed more light on the first COVID-19 related death at the institution in April. He said the 37-year-old patient had childbirth complications, severe infection, pneumonia and diabetes after delivery of a baby in another hospital.
This patient had a baby at Alimosho General Hospital, and then I think it was said that she had a naming ceremony, a lot of people came, and then she became sick. They took her back to Alimosho General Hospital, where she was treated for infection, but then she developed respiratory distress and needed intensive care, so she was brought here. When she got there on a Wednesday, COVID was not suspected and management started. But on Thursday, the team that saw her suspected COVID, and then she was tested and she came out, positive, but unfortunately the result came out after she had died. She died on Friday morning, but the result came back on Saturday. And after that, we had to isolate doctors, nurses, health workers. We had to fumigate the ward where she was. Those health workers had to go away for 2 weeks. They were fully kitted. But at the point that she became very distressed, at the point that she became very sick and was about to die, in the effort to resuscitate her, nurses and doctors, because of the passion, because of the way they just wanted to save her life, there might have been lapses. You know, some people might not have worn their masks. Some people might not have worn their gloves. You just want to do, a compression on the chest. You may not remember at that moment. That's what happened. The result was that one doctor and one nurse, as well as one attendant, came out positive after they were tested. All the others came out negative because we isolated everybody that had any contact with her, including anesthetists, including departments where referrals were taken, like the Department of Medicine. They came to see her. All of them were tested, but only 3 people turned out positive. Eventually, the husband as well turned out positive. So we had to now trace all the places where the husband had been, and we tested everybody that he had contact with.
In a bid to intensify efforts in the fight against COVID-19, Professor Fabanwo said LASUTH is putting up a 30-bed holding bay to complement the 16-bed ward for suspected COVID-19 patients pending the release of their test results. This is the first of its kind in the country, which will help relieve the burden of suspected COVID-19 patients whose faith are yet to be ascertained.
When the whole pandemic started, our response was to construct a 4-bedded holding bay so that suspected cases could be kept there. At a point in time, it became clear that that 4-bedded bay was not going to serve us. It was not big enough. So we had to collapse a whole ward, 16-bedded ward, and turned it into a holding bay. Again, just at the point that that ward, a 16-bedded ward, was not going to be big enough for us, fortune smiled on us. A friend of the hospital came to us and asked that he wished to build a maquet, a holding bay for us. He made it clear that he was not building a treatment bay or a treatment center, that was building a holding bay where suspected cases could be kept. And he explained to us that the reason he was doing that was because 2 of his relations who were suspected COVID cases, they were hanging in the balance. Because the treatment centers were not taking them, because they had not been confirmed positive, then most hospitals were also rejecting them because they were COVID suspects, so they were asking for their test results. So he thought that there was a need for a midway kind of place where suspected cases could be kept until they got their results. We saw logic and sense in it, and we bought into it.
How many beds is it now?
It's a 20-bedded holding bay, and it's going to be the very first one in Nigeria. We've not heard of any state that has thought of having a holding bay for suspected cases.
The CMD also commended massive contribution of LASUTH expertise in the area of research and improving the knowledge base in containing the coronavirus in the state. He said LASUTH has developed 6 COVID-19 related research proposals to enhance containment strategies against the pandemic. Its research committee is conducting studies on 4 drugs that can be used for the treatment of COVID-19 patients. Its ethical committee is also reviewing and giving approvals to the proposed studies from the state research committee.
And when the pandemic started, we asked our research committee to quickly start working on proposals that are COVID related so that we will contribute to the knowledge base for COVID. And I'm delighted to tell you that as we speak, we have developed 6 research proposals on various aspects of COVID. Majorly, 2 of our researchers are working on 2 herbal preparations that may work in abating the cause of the disease. We are also looking at the role of clotting factors in determining the outcome of the disease. Somebody is working on the role of comorbidities. The ethical committee in LASUTH has been involved in reviewing all the proposals that have been coming in from the State Research Committee. Our ethical committee had been the one that has been reviewing it. Our community health residents are serving in the different isolation centers in the state. Also, 6 of our doctors were seconded to the airport at the beginning of the pandemic to screen visitors to Nigeria, and they spent 6 weeks there. And when they finished there, they've now been posted to do other duties. A lot of our community health residents are working in what they call contact tracing and case investigation duties as we speak. They are not available for us for duties. They are working in the state. The head of the disease surveillance unit at the EOC is one of our consultants, Dr. Bisola Adebayo. She's also from the community health and primary care unit. The coordinator of the biosafety and biosecurity lab, Dr. Bamidele Mutiu, is a LASUTH consultant. You understand? Now, so you can see that also about 15 consultants and resident doctors from LASUTH under the aegis of the Association of Public Health Physicians of Nigeria, including Dr. Kuenu, Dr. Yinka Adeniran, the head of the department, Dr. Tony Adeyemi, Dr. Akinyinka, and doing a lot of information dissemination about COVID regularly, almost on a daily basis, till date. They are LASUTH people, So I think that by and large, if you look at it in a fair manner, LASUTH has risen up to its responsibility as a tertiary institution and has done what it needs to do in this pandemic era.
On the herbal remedy debate, Professor Fabanwo urged the State Traditional Medicine Board to collaborate with LASUTH in the area of dosage and clinical trial.
COVID is a viral disease. COVID, we know, we are scientists, we know that if you have good immunity, the virus will enter your body will set up its immune defense and then fight the virus off, and after a few days or so, you get better. And that's why we say that people who have background diseases, etc., people who are old, people who are immunocompromised, may be the ones who will succumb to the disease. So the role of herbs, in my own opinion, is not about killing the virus. I don't think herbs kill the virus. But I think herbs may do 2 things. They may help you to boost your immunity, because we know antioxidants, help with immunity. And therefore, if some of those herbs have antioxidants, and we feel that they have, we feel that some of them are rich in vitamin C and even vitamin D. So if we can extract all that and give people to drink, may help them to boost their immunity. Also, herbs may help in ameliorating some of the other symptoms of the disease, which may be quite uncomfortable. So those are the things that I see the herbal mixtures doing, not necessarily curing or killing the virus. Then I want to address the issue of people who are just randomly taking herbs. A case has been reported of a woman who almost died because she started taking ginger, turmeric, dongoyaro, all of them mixing together and drinking. She had a perforation of her gastrointestinal tract. Yeah, she almost died. She almost died. So people need to be careful about what they take. What I would advise people really is to just take large doses of vitamin C. That's all I would advise people to take. If you must take ginger, garlic, turmeric, whatever, take small quantities. Don't take too much. Traditional Medicine Board needs to work closely with a teaching hospital like ours. You see, they may have the herbs, but we have the scientific ideas to put up a good methodology for research. The dosages are things that we may be able, using our laboratory equipment, to determine precisely. Okay, when we extract, for instance, we can decide what weight of the herb that we are going to extract, so that we can put a little bit of specificity to the dosages, more than somebody who's just researching outside that has no access to laboratory equipment. So I think they need to collaborate with us in whatever research they are doing.
LASUTH has also adopted homegrown solutions to the management of COVID-19, as the institution is now manufacturing personal protective equipment.
The first challenge is the morale of the staff. You see, the health workers are frontline people. The health workers are carrying out a sacrificial duty. To stay at your duty post at these times, with or without PPEs, is sacrificial. A lot of people will want to run away, but the health workers are not running away. They are there. They have never abandoned duty. So we feel that they must be incentivized. They must be incentivized. Secondly, we must kit them properly. We must provide appropriate PPEs for health workers. Now, that is the bad side of the story, is that PPEs are no longer commonly available. When you find them, they are very expensive. So the immediate response should be to look into homegrown solutions towards the provision of PPEs. And we are already doing that here. As I speak to you now, we are let me give you an example. There is a gown that we call a sterile disposable surgical gown. That's what our surgeons wear when they want to operate, to protect themselves from spills of blood and fluid. Also, because of COVID, some of our workers who interface with patients at the emergency units or even in the clinics, would have to wear it to provide protection for themselves. Each one costs about 4,000 naira, and is single use. So for every day that I see a patient, I have to adorn a 4,000 naira gown, and at the end I throw it away, and that's it. It's not sustainable. So what we've done now is that we have looked for a good material with which we can sew that kind of gown and people can wear, and then it can be reusable. We can clean it and dry it and use it again. Those are the kind of thinking that we need to do now. And I'm happy to tell you that the First Lady of the state, Mrs. Ibijoke Sanwo-Olu, is very keen on homegrown solutions to the provision of PPEs. I've had one or two conversations with her, and we've looked at various options that can be explored. For instance, we have information that the N95 mask is being manufactured in Ghana, next door to us. So we are looking at the possibility of finding out how they are doing it, whether we also can borrow from the ideas they are using and do it. The fabric we use is being brought from Aba, and with this interstate restrictions, is giving us a little headache.
For the mother and child at Anyike House, this tertiary hospital would go the extra mile to keep them safe from the pandemic.
We suspended some routine services, but in Anyike House, antenatal care is going on. We're still running some clinics. Deliveries are going on. We are taking emergencies, and we are doing elective cesarean sections even as we speak. However, because of our heightened awareness for COVID, every patient that is coming in is screened with history, with temperature, with pulse oximetry. Pulse oximetry is a device that you use to know the saturation of your blood of oxygen, because one of the things that happen when you have COVID is your oxygen saturation drops because the lungs are not working well. Okay, so once we do you take history, do you have cough, do you have chest pain, sore throat, have you traveled recently? Of course, well, these days we know nobody is likely to have traveled. Then we take your temperature, it's high. You have a cough, you have a sore throat, your temperature is high. We do a pulse oximetry, your oxygen saturation is low. You are a COVID suspect and you don't enter the hospital. So there's no chance for you to contaminate the people who are in. So we take you to our isolation ward, which we have now 16 bedded.
We decided to have a first-hand assessment and inspection of the quarantine bay under construction. The Director of Clinical Services and Training, Dr. Ibrahim Mustafa, was our guide.
Okay, and we'll take 20 patients.
He told us how LASUTH came up with the design of the holding bay facility and why it is imperative at this time.
We needed a place that we can hold the patients before they get their results, and then they get transferred if it's positive, or they get their treatment here if negative. So we discussed with the commissioner. We had started the construction. The commissioner for health, yeah, Professor Akin Abayomi. We discussed, and he advised us that for our plan, we needed to have the bay cubicled, partitioned, such that patients don't get to mix. It's now going to be like self-contained.
You have the toilets there.
Each room will have its own toilet. It will be equipped with its own AC. It will be equipped with its own hair extractor. It will be one room, one patient.
Molecular testing is not that fast.
He explains further how the new bay will be put in use such that suspected COVID-19 patients would not spend more than 48 hours before they get their test results.
The number of tests that you'll be doing, you may not necessarily get your result within 5 hours. But we are looking at a situation where we get the results within 24, 48 hours. So if we do that, patients will not be staying for so long in the quarantine before the decision is taken as to what we want to do with them. Either we transfer them to many of the treatment centers around, or we continue the treatments right here in LASUTH. If the patient turns out to be negative, that is. Yeah.
The Lagos State University Teaching Hospital, LASUTH, is a state-owned teaching hospital in Lagos State, southwest Nigeria.
And there's a package on this edition of Inside Lagos. If you know anyone who has met a COVID-19 patient, please be supportive. Encourage the person to call their state hotline for testing. For Lagos, it is 08000 Corona. I'm Adedoja Salam Adeni. See you next time. Thanks for watching. Bye-bye.